Here are the 5 signs that you need to see a urologist and schedule a routine appointment as soon as possible. If you present just one of these 5 criteria that I am about to list, do not delay. Many people believe that you only need to visit a urologist when facing an adverse event or a catastrophe. We are talking about things like a kidney stone attack, seeing blood in the toilet bowl, acute pain in the genital area, or a complete blockage of your urine flow. But the truth is, waiting for these emergencies is a mistake. The reality is quite different. Your body often gives you subtle signals long before the emergency room is necessary. Today, we are going to walk through the 5 signs your body gives you that you need to understand as a clear message to seek professional help. We often ignore these signs, or we chalk them up to just getting older, but they're indicators that something needs to be evaluated. Let's start with number 1. This isn't a symptom, but a fact of life, turning 45 years old. If you are 45 years old and you have never done a urological checkup, that age alone is an indication that you need to go. Simply hitting this milestone means it is time for a routine assessment. However, for certain groups of men, this isn't just a suggestion, it is a requirement. We are talking about patients with a family history of prostate cancer. If your father or brother had it, your risk profile changes. This also applies to individuals of African descent, as statistical data shows a higher prevalence and often more aggressive forms of prostate issues in this demographic. Furthermore, we now look closely at men with specific genetic mutations. If you know you carry mutations associated with the BRCA1 and BRCA2 genes, you fall into this high-risk category. For these men, it is mandatory to begin screening for prostate cancer at age 45. This initial consultation is crucial. It involves a clinical analysis, a detailed history of your health, a physical exam including the digital rectal exam, and the PSA blood test, along with any other complementary exams deemed necessary. Now, if you don't have a family history, you aren't of African descent, and you don't have those genetic markers, the standard guidance often suggests starting the screening at 50. But generally speaking, 45 is the age where you need to start paying attention and having that conversation with a specialist. The second sign is something many men ignore or think is normal, waking up more than once at night to urinate. We call this nocturia. Waking up one time during the night is generally considered within the normal range. However, waking up 2, 3, or 4 times is not normal, and it can bring serious consequences to your overall health, including your sexual health. Men who suffer from nocturia, this habit of waking up multiple times, are severely prejudicing their hormonal production. You have to understand that testosterone production occurs primarily during deep sleep, specifically during the REM cycle. If you are constantly interrupting your sleep to go to the bathroom, you are fragmenting your rest and preventing your body from reaching those deep restorative stages where hormones are optimized. Furthermore, the production of the principal vasodilator associated with erections, which is nitric oxide, also occurs significantly at night. It is physiologically normal for a healthy man to have involuntary erections during the night and early morning. These are essentially maintenance checks for your system. If you are waking up 3 or 4 times a night, you might be compromising this mechanism, leading to issues that are considered abnormal. So, if your sleep is broken by the need to pee, that is a red flag. And speaking of nitric oxide and maintaining your performance, if you feel like your system is already compromised, or if you just want to restore that youthful hardness without resorting to dangerous pills, you need to see this. There is a bizarrely simple 7-second morning ritual involving a specific purple tonic that targets the root cause of dysfunction, a toxic enzyme that blocks blood flow. It's helping thousands of men stiffen their soldier naturally. I found a short presentation that explains exactly how this works. Point your camera at the QR code on the screen right now to watch it. I've also pinned the link to the top of the comments below for you. Do not ignore your sexual vitality. Give it a look. Now, moving on. Sign number 3 involves specific alterations in your urinary stream. You need to pay attention to the mechanics of how you urinate. Has the jet become slower? Does it lack pressure? Is the stream cut off or intermittent, where it starts and stops? Perhaps most importantly, do you have the sensation of incomplete bladder emptying? This is that feeling where you finish urinating, zip up, and wash your hands, but you still feel like there is liquid inside your bladder. You feel like you didn't get it all out. This sensation often forces you to go back to the bathroom multiple times in a short period. These symptoms, much like the nocturia we just discussed, are classic, characteristic signs of benign prostatic hyperplasia, or BPH. This is the non-cancerous enlargement of the prostate that squeezes the urethra. However, these symptoms can also be associated with other pathologies, such as problems with the bladder muscle itself or strictures in the urethra. Regardless of the cause, if your flow has changed, do not hesitate. You need to investigate why the plumbing isn't working as it used to. The fourth sign is one that often causes alarm, but is frequently misunderstood: penile irritation. This can manifest as redness, swelling, or itchiness on the penis, specifically on the glands or the foreskin. This irritation might appear after sexual intercourse, or it might just show up spontaneously out of nowhere. It is not normal for the penis to become irritated, swollen, or red after sex. This is often an indication of balanoposthitis. This is an inflammation of the glands and the foreskin, that skin that covers the head of the penis. This is obviously much more common in men who have not been circumcised, where the excess skin creates a warm, moist environment. Many patients develop this irritation after sex, after masturbation, or for no apparent reason, and it is frequently caused by fungi, specifically Candida. Genital candidiasis is one of the main causes associated with this inflammation. Now, here's a critical piece of medical insight that you need to hear. A significant portion of men who develop this penile irritation spontaneously, especially those over the age of 50 who have never had issues like this before, are actually showing the first signs of diabetes. These patients may be opening a clinical picture of hyperglycemia and type 2 diabetes mellitus. The excess sugar in the blood is excreted in the urine, and that sugar remains on the skin of the penis, providing the perfect food source for fungus to thrive. We see patients discover their diabetes diagnosis because of this irritation. They come in for the redness, we run blood work, and they have a hemoglobin A1C of 8, 9, or 10. They had no idea they were diabetic. Their only symptom was the irritation. These patients need to be evaluated. Treatment often involves topical creams or oral antifungals. However, if the condition keeps coming back, if there is recidivism, there is a clear indication for a postectomy, which is the surgical removal of the excess foreskin, commonly known as adult circumcision. But the root cause must be identified first. The fifth and final sign, but certainly not the least important, are the clear signs of andropause. We call this DM, disturbance of androgen in the aging male. Most men begin to experience a drop in their endogenous production of testosterone of about 1 to 2% per year starting around age 40. However, this process can happen much faster depending on your lifestyle. Smoking, a sedentary lifestyle, obesity, hypertension, and other metabolic diseases can accelerate this decline. It is very common that starting from age 50, men begin to show clinical signs of this testosterone drop. We categorize these signs into 3 pillars: physical, sexual, and cognitive. The physical signs include excessive tiredness that sleep doesn't fix, fatigue, difficulty gaining lean muscle mass despite exercise, and a distinct ease in accumulating body fat, especially around the midsection. The sexual signs are often the most specific and noticeable. These include the onset of erectile dysfunction, a noticeable drop in libido or sexual desire, and disturbances in ejaculation. This could mean premature ejaculation or the opposite extreme, delayed ejaculation or anorgasmia, the inability to reach climax. You might also notice a reduction in the volume of semen produced. Finally, we have the cognitive or behavioral symptoms. When testosterone levels crash, men often experience mood alterations. This can look like irritability, increased anxiety, insomnia, difficulty concentrating, and what is often described as brain fog. If you identify with any of these symptoms in your daily routine, if you are tired all the time, your mood is unstable, your sexual performance is suffering, or your body composition is changing for the worse, this is something that is bothering you, and it needs to be addressed. You should find a specialist to perform a hormonal dosage panel. If we find an association between your clinical symptoms and low levels of testosterone in your blood, Hormone replacement therapy can be transformative. It can bring significant clinical improvement to your quality of life. Do not wait for all 5 of these signs to appear. Do not wait for extreme pain or a health disaster. Preventative care is always superior to reactive care. If you recognized yourself in just one of these scenarios, book that appointment. Your health is your most valuable asset, and these signs are your body's way of asking for help. Take action now.